there are some really simple yet powerful breathing and vocalization techniques that you can use in your labor and birth that are going to increase oxytocin and endorphins and decrease adrenaline. So when you are in the first stage of labor, okay, so when you're in early labor as well as established labor, so this is when you're having regular contractions, want you to be using a breath that is very slow and very controlled. And the aim of this breath is to make the exhale longer than the inhale and to breathe out with an open mouth. Okay, so it may look something like this. Breathe in for 3 seconds and out for 4 seconds. The duration of the breath will be up to you and what you're feeling, but the longer you can get it, the better. So the longer inhale and the longer exhale, the better and more controlled and more adrenaline you will release. Always remembering to try and make that exhale longer than the inhale. So I've got some footage of when I was in labor with my second daughter of myself using this breathing technique that we're going to watch really quickly right now. Now this breathing technique can actually be used in conjunction with something called vocalization. Now vocalization has been shown in research to help you dilate and to open your cervix, okay? So what it involves is making these deep noises in our throat, and that's because our throat and our cervix are linked. So when we are relaxed and making vibrational noises and opening our throat, the same is happening in our cervix. So I want you to try this with me. I want you to take a big breath in, and then on the exhale, we're going to make these deep vibrational sounds. And as we do this, I want you to take your attention down to your cervix and see how it feels. So let's try it together. So big breath in and a long vibrational sound out. And now I want us to try together doing the opposite. So we're going to take a breath in, but we're going to hold it and make high-pitched sounds. So let's do this together. So big breath in, hold it, and make high-pitched sounds. Feels kind of silly, but what you may have noticed is how we tighten everything down below. So you may be able to see now how relaxing your throat, opening your throat will actually work to relax and open your cervix so that your baby can be born easier. Now, when we think about this as well, and we think about the kind of sounds that we make when we're fearful, we clench up, we make high-pitched, no, I can't do it, I'm so scared, please make it stop. Everything tightens. But when we are making sounds that are deep and long and vibrational, I want you to feel how everything softens. So when we go, everything relaxes and softens and opens. Okay, so I have another little video of me using this technique in my labor. Let's take a quick look. So the next breathing technique is to be used when you are pushing, okay? And what this breathing technique does is it focuses all of our energy down into our bottom. So before, when we were exhaling, we were releasing all of the energy out through our mouth. But with this breathing technique, we're going to take that breath in, but instead of blowing it out here, we're going to focus it down deep into our bottom. So that might sound something like this. Okay. Sounds like I'm doing a big poo. And actually, when we're pushing in labor, that's the same pushing technique as we would use if we were on the toilet doing a poo. Okay. Now, if you are having a normal physiological birth and you don't have any pain relief or epidural on board, you will find that your body will just take over and do this for you. You may not notice a lot of control. However, if you can remember just to take that big breath in and that long breath down into your bottom and go with that sensation instead of holding your breath and holding back and being fearful of that sensation, you will help your baby to be born quicker. Now, if you have an epidural, then you will actually need to consciously do this pushing technique, okay? And the midwives and the doctors on the day will be there to guide you through this. So some natural pain relief tools that you might want to use in your labor and birth include basically anything that is going to maximize endorphin release. So like we talk about in the Birthspace section, your nice, calming, beautiful, serene environment that is going to help maximize endorphin release. That is a pain relief technique. The other one that's really helpful is the endorphin touch massage. So this is a really simple massage, and it just basically involves having your partner or support person use just the tips of their fingertips and lightly stroking your back, almost like a back tickle or a fairy touch. It's really light, it's really sensitive, and this is a really, really great soothing, calming, and endorphin releasing massage. Other tools that you might like to include in your pain relief toolbox are some acupressure points. So these points that you can actually find online, so you can go onto YouTube, there's lots of great videos, and certain points on the feet, on the shoulders, on the hands that actually help labor progress and are pain relief techniques, so they're really powerful too. Aromatherapy is another tool. So anything again that's calming, that's going to reduce adrenaline, so your lavenders, things like that. Clary sage has been used for a long time to help labor progress also, and it's something you can, when you're wanting to bring on labor as well, have a nice clary sage bath or rub on your tummy. You can't diffuse or burn clary sage in hospital because there might be someone down the hall, say, who's in preterm labor and they're trying to stop labor, but you can put it on a little handkerchief that you can smell, piece of baby's clothing, something like that, and that you can directly inhale. There is another option called sterile water injections. Now, this is a natural pain relief tool for women who are experiencing labor in their back. And it basically involves 4 little points of sterile water being injected under the skin, and it blocks the nerve pathways of that pain. So it does really, really sting going in. It's quite intense, but then it does provide really good pain relief for a number of hours after. So something to consider if you're experiencing labor in your back. Another natural pain relief technique is a TENS machine. So these are generally available for hire. And again, they're little pads that you pop on your back that send a little electric pulses and block those pain pathways as well. TENS machines are great for an early labor at home, so that might be something that you're interested in. Sometimes people will also use things like a stress ball or a little comb that when they're having a contraction, they can clench their fist around. And again, this kind of, because it's causing a mild pain in your hand, distracts from the other pain that you're feeling with the contraction. So some people find that really useful as well. And then of course you've got warmth, so heat packs, a warm shower and a warm bath. So all of these things really, really powerful. And especially if you're the kind of person who, when you have your period, uses a heat pack or has a nice warm shower and it helps, then it's likely to help you in your labor as well. The other tool to help with pain relief is actually mobilization. So again, if we say did slam our finger in a door, what do? We quickly move around, we let our body do what it feels like it needs to do to get rid of that pain. And it's the same when we're in labor. So if you're having a contraction and you feel the need to move your feet really quickly, walk around, or move in a way that your body feels like that it needs to be comfortable, this is going to help you cope with the pain. And if you think of the opposite of that, how horrible it is to be strapped, say, on a bed, feeling a pain and you can't get up and do what feels good. So mobilization is a really powerful pain relief technique. And it also reduces the length of your labor, which, like anything, if it's going for a really, really, really long time, then your mental strength in coping with that pain is going to slowly deteriorate. So shortening the length of your labor is a pain relief technique, because we know that everything is experienced worse when we're really tired and exhausted. So one of the best ways that you can reduce adrenaline and increase your oxytocin and endorphins is through the environment or your birth space. Okay, and we know what this does is it shortens the length of your labor and gives you a less painful labor as well. So really, really important to have a little think about, when you're doing early labor at home, what does this space look like for you? Who's in your space? Have you got people staying with you? And really just have people there who you feel super duper comfortable and relaxed around. Okay. The other thing is set up for yourself a little birth space at home, whether that's with fairy lights, candles, whatever it might be. Baby's little bassinet there is going to help you with that positive visualization. You've got your birth ball so that you can really, when you're in early labor at home, help your body get into, the right headspace for all of those good hormonal releases that we want to happen in labor and birth. So really, when we're thinking about birth space, we're thinking about setting up the space somewhere where you feel so relaxed. Okay, so I usually say to people, think day spa vibes. All right, so you really want it to be somewhere where you could just easily fall asleep. It's that calming and relaxing and soothing, or somewhere where you could have an orgasm. Okay, so if you think about, the kinds of spaces where we feel just super comfortable and calm, and there's no pressure, there's no time limits, we've got nice dim lighting, we've got beautiful, candles, fairy lights, beautiful scents happening, music playing in the background, all of this kind of thing is going to really set up that space, and your hormones of labor and birth will love it. Okay, so really thinking about that at home, but also thinking about that for when you go into hospital, and even more so important actually when you go into hospital, because we are more naturally inhibited at hospital. It's not our usual comfy place, which is home. All of a sudden we're there, we've got bright lights, we've got strangers, we've got loud noise, medical equipment. So we really need to work hard to turn that space in the birthing room into one that again is day spa-ish or day spa vibes, okay? Because if we think about trying to fall asleep, having a really good sleep or having an orgasm in a hospital room when we've got the lights on, maybe midwives walking in and out, loud talking, oh, I'm gonna be in 30 minutes and check on your progress and see how you're going. That kind of pressure and that kind of environment is not naturally, going to allow your hormones to do what they need to do. So when you go into hospital, remember to set up that birth space. So put your music on, take a boombox in with you, take some fairy lights in, take some affirmation posters, take a nice diffuser, so a nice comfy blanket or cushion or whatever it is that brings you comfort. And really don't be afraid to set up this space as your own. This is your birth space, so really feel comfortable to make it your own and a space where you feel nice and relaxed and calm so that you can do what you need to do. So water immersion and water birth. Water immersion and birth is such an amazing option. So immersion is when a woman just gets in the pool for pain relief but births out on the land. And water birth is obviously when baby is born into the water. On a personal level, I absolutely loved giving birth in the pool, and the feeling of getting in the pool was just so incredible. You feel buoyant. The warmth is such amazing pain relief. And research has shown I'm not the only one who felt this way. So research has found really high maternal satisfaction rates for water immersion and water birth. It decreases the need for things like an epidural because it's that beneficial. And so with that then comes a reduction in the associated risks of things like hemorrhage, of forceps, vacuum, episiotomy, fever. All of those additional risks are therefore reduced. And some research has even found a reduction in emergency cesarean section rate. So we know that women are in the pool, they've got free movement, they can get comfortable, they're in kind of this protective, space where it's hard for medical professionals to interfere unnecessarily. The woman is in control. Okay, so a really, really beautiful, powerful pain relief technique. And so there are some very, very small risks, and these risks are absolutely minuscule. The benefits of water birth greatly, greatly outweigh them. But some of the risks are a very small risk of infection, of asphyxia, of aspiration, and of damage to the umbilical cord. But what I will say is that water birth is generally only done with very low risk women and babies. Every hospital is a little bit different, but and also done with midwives or doctors who have done extra training and are trained in water birth. So they're always done under really controlled circumstances, really, really safely. And the benefits are just so incredible that the small risk is really, really minute. Okay, and so what happens is when the woman is in the pool giving birth, baby's head will be born, and because baby has come from a fluid-filled environment inside of mum's tummy out into another fluid-filled environment that is generally kept the same body temperature as mum, then baby doesn't actually realize that they've been born yet, and we don't touch or rub baby here. We don't stimulate them. And then what happens is when baby is brought up out of the water in the next couple of contractions, that cool air hits baby's face, and that's what then stimulates baby to take his or her first breath. And so I will say that babies who are born into the pool are generally born really chill, very calm, because it's such a smooth, lovely transition for them from life inside of the womb out into the outside world. Okay, and also baby is still receiving all of their oxygen from the umbilical cord that's still pulsating when their head is sitting there underwater, and then even when they're up above water. So I strongly, strongly encourage you, if water birth is an option that's open to you, to consider it for your labor and birth, because it's such a really beautiful, powerful pain relief technique and birthing option.